Hi, everyone. Welcome back. Today, we're joined by Dr. Eddie Stenehjem to give our community update on COVID-19 in the state of Utah and what's been happening in the past week since we last spoke. Eddie, as always, thank you for joining us.
Thanks for having me.
I want to talk about case trends first. We'll start with that. This data is from yesterday, just so everyone is aware, but as of yesterday, our total case count in the state was 47,521 total cases. The reported daily case count yesterday was 359 cases with about an 8.5% positive rate. And we have a total of 377 deaths and 2,832 hospitalizations. Eddie, will you break that down for us a little bit? How do you feel like we're doing as far as case counts goes, hospitalizations and things like that?
Yeah, we're trending very, very well. It's a welcome relief from, most of July and kind of the first part of August. We're seeing consistent declining case counts, not just in Salt Lake County, but across the state of Utah. We're seeing, decrease in case counts in essentially all age groups as well. We are seeing decrease in testing too, and that is gonna follow decreased community transmission. So a slight decrease in testing is most likely expected. Whether or not the amount that we're seeing is due to decrease in community transmission or a decrease in the way that the community is now seeking care in terms of how they feel about getting tested for coronavirus is yet to be determined. But when we see decreasing case counts along with decreasing testing, you have to look at these kind of complementary metrics of infection rates. And one of the big things we look at is hospitalizations. And keep in mind that hospitalizations are going to lag considerably from our case count curves. And what we're seeing now is a considerable decrease in hospitalizations for COVID-19. This is exactly what we want to see. And what this tells us, it's not, it doesn't tell us what the community transmission of that young, healthy population is doing. What it tells us is the community transmission of people that will get infected and then get hospitalized is going down. So it's really showing us that among the older population, the immunocompromised population, those with comorbidities, that group is having decrease in case counts, which is leading to decrease in hospitalizations, which is, a really great sign and a relief for us, here across Intermountain Healthcare. At Intermountain Medical Center, we typically round on between 45 and 50 patients each morning. That was the numbers back in July. This morning, we rounded on 30 patients. And so you just get an idea of that, decrease burden on our hospital is, really, really quite significant. Our percent positive hasn't changed all that much. We're still at about 8.5%, 9% positive as reported by the state. But again, keep in mind that is going to be really dependent on the denominator of people that get tested. So the total number of people tested. And if that is changing with the epidemic, then how we look at that percent positive is also going to have to change as well. And so we're going to have to be pretty cautious about that. But right now, we're sitting in a decent spot, decreasing case counts, which is really, really important. As we've talked before and we've belabored before, we got to see these case counts go down before kids go to school, or now kids are in school, and especially as we get into the winter.
So I guess from those case counts and that positive rate, you can infer that a lot of people that are getting tested now are the people that really need to get testing. Is that why the positive rate hasn't really changed, even though the case counts are going down?
That's one hypothesis, is that people are becoming more and more comfortable with this and know when to get tested. And instead of going to get tested with any symptom, thinking it might be coronavirus, it could be that the public is becoming more educated about this and saying, okay, if I've got cough, shortness of breath, pharyngitis, or sore throat, I'm going to go get tested, and not necessarily those really kind of symptoms that aren't consistent with COVID-19. So that's a good hypothesis, one that I haven't proven, but it certainly is possible.
The other thing I want to talk about too is immunity. There was a recent trend on Twitter last Friday talking about how the CDC came out with this report stating that if you'd recovered from COVID-19, you were immune for up to 3 months. And the CDC had to quickly release a statement back, kind of clarifying what they meant by that. They more so meant you do not need to get tested again if you do not have new symptoms within that 3-month period. Say your employer wanted you to get tested again and come back with the negative. They were saying that's not required. can you break down immunity a little bit more for us and talk to us about if we're at all on our way to what we call?
Yeah, happy to. That CDC release kind of got picked up by the media and went in a direction that was not intended by the CDC, I believe. The reason that the CDC said don't get retested in the next coming 3 months is that people that are infected, whether it be asymptomatically, mild to moderately, or severely, many of those people can shed virus in their nose and upper respiratory tract for weeks to months. And so it's not that these people have persistent infection in most cases. These people can shed remnants of viral RNA for weeks and weeks and weeks. And so if you continue to retest them, they're going to be positive and positive and positive. But what we've seen is that out from 10 days from symptom onset, anything past 10 days, that your chance of transmitting that infection, even if you're swab positive, is essentially zero. And what we're picking up on those so the days 10 to 90, is you're picking up really small amounts of virus and viral fragments, which do not transmit the infection. Okay, and so why the CDC said don't get retested until after 3 months is to prevent those continuous positive tests. And then many employers will say, oh, you can't come to work. Well, the patient can come, the individual can come to work. They're not transmissible after 10 days. And so we really want to decrease those kind of long testing tails in patients that don't need it. But they did say that if you develop new symptoms within that 3-month period, by all means, go and get evaluated by a physician or advanced practice practitioner and see if you have, disease. We don't know whether or not you can be reinfected with coronavirus, after you got infected the first time. Our hunch, which is, I think, now kind of being borne out by some data, is that you likely will be protected for a period of time. The pandemic has been going on long enough now that if we were going to see reinfection occurring month 3, month 4, month 5 after primary infection, we likely would have seen some by now, given the sheer number of people that have been infected. And we haven't seen definitive proof of reinfection identified at all. And so I think if there is the possibility of reinfection shortly after your primary infection, I think it's going to be very, very rare. What we don't know is what and how long that protection is. So how durable that protection is. Is it going to be 3 months, 4 months, 5 months? We just don't know that. And does an antibody status, does that indicate any kind of level of protection? And so we've got a long ways to go. We don't know whether or not you can get reinfected. Most likely there's going to be a period of protection. We just don't have any idea how long that is. And we're going to certainly get more information on this as we get into the kind of fall and winter, as people likely are going to get and see more virus. But as of right now, the immunity part is challenging, but I think what we're seeing is that there's going to be level of some protection. There's really some interesting data coming out now looking at people that have never been infected with coronavirus having some levels of T cell protection. And so your immune system is broken down in the innate and the adaptive immune system, and the adaptive immune system is broken down into the humoral or the antibody response or the cellular, your T cells and your and other cellular response. And the theory is that there's likely people out there that have been infected with other coronaviruses that have stimulated a T cell response that likely has some cross protection. And this may be the beginning of unraveling the secret of why some people get really sick and other people don't get sick. But that science is evolving, and we're starting to see some signals that there may be some level of protection from prior coronavirus infections with the T cell response. And so we're really going to have to see where that science goes, and potentially if there's a lab test to show, highly susceptible people versus not susceptible people. But lots of work going on the immunologic front. And then we're also going to learn so much about the immunology of this with our vaccine work. And so we know that vaccines are stimulating an antibody response, and we're also stimulating a T cell response or a cellular response. And it's going to be interesting to see which of those is protective and what's the best mechanism to stimulate that response. And so lots going on in the immunology of coronavirus world. And I think lots of answers will be coming out probably in the next few months.
It's probably important too for people to note too, just because you had COVID doesn't mean that you should loosen up the way that you are currently living your life. It doesn't mean you should no longer wear a mask or that social distancing isn't a thing anymore, because you still, I mean, we, like you said, we don't know if you can get reinfected. So is it still important for those people who've recovered to follow the proper precautions that everyone else is supposed to be following?
Absolutely. Absolutely. Set a good social standard of saying, even if I've been infected, I'm going to wear my mask. I'm going to wash my hands. I'm going to avoid large crowds. We just need to know more before we can make any kind of recommendation on that. There was initial thought about kind of like COVID passports. Like if you've been infected, oh, you're free to do whatever you want. That is definitely not recommended. And, even if you've been infected, you really need to wear a mask and continue to follow those standards.
We just got a question on Facebook too, a little bit to explain a little bit more about viral loads. They specifically asked, does the decrease in viral load, for instance, from an asymptomatic person, give you a less viral load and make you less sick?
Yeah. So the viral load, you can think of it any number of ways. So there is the exposure you've been exposed to in terms of the burden of the virus. So how much burden of virus have you been exposed to? And does that correlate with illness? And then you also think about what is the viral load in somebody who is infected in terms of how does that relate to severity of disease. We'll start with the latter first. What we know is that we can see high viral loads in asymptomatic people and also in severely ill people. And so there isn't a consistent trend. In some studies, there has been a trend, but there isn't a consistent trend to say high viral load in infected people correlates with more severe disease. We've seen plenty of people with asymptomatic disease having high viral loads, and we can measure that using a surrogate marker called the cycle threshold of the test. We won't get into the details of that. But we definitely have seen people that are asymptomatic with high viral loads. Okay, so that's been seen. There's some correlation with severity of illness. Keep in mind, in the people that get the most sick, many times that's occurring after 10, 12, 14 days after initial infection. And remember, your viral load goes way up initially and then kind of tapers off. And many times what we're seeing in those people that are getting really sick kind of late after infections, it's due to the immune response that the body has made to that virus, causing such an inflammatory response that they're getting sicker. And so it's not necessarily the viral load, but it's the reaction from the immune system to the virus. And so not a great correlation between viral load and severity of illness. Now, the second thing, which I think that the listener is referring to, is what about the viral burden that you're exposed to? So let's say you're out, you're not wearing a mask, somebody with coronavirus has high viral loads, comes and sneezes in your face, and you get a huge viral inoculum, versus somebody who's wearing a mask and encounters that patient that has a high viral load and sneezes in their face, and now they're protected because maybe they're wearing glasses and a mask. There's data coming out now to show that if you wear a mask, that you may actually have lower severity of disease. And the hypothesis there is that wearing a mask, even if it's wearing in like not appropriately, but wearing a mask potentially decreases the amount of virus you're exposed to and gets infected with, and therefore maybe decreases the severity of infection. That's really early in terms of the science of that, but that's currently the hypothesis, that potentially wearing a mask can also decrease the transmission from you to the community and decrease community-based transmission, but also may protect you from having severe disease by decreasing the viral burden once you're exposed. Again, that science is very early. It's pretty speculative, but that's, one of the kind of hypotheses out there.
Someone else just asked us if there's any sort of vitamins that they can be taking to help if you are infected or to help reduce your chances to fight off the potential infection.
Yeah, I mean, the thing that's been looked at is zinc, and there's lots out there about zinc, but the studies that we've seen in terms of the randomized controlled trials are looking hydroxychloroquine plus zinc versus placebo hasn't really shown a definitive improvement at all. And so we do not have any definitive data that supplementation with any kind of vitamins or minerals is of any benefit. And so just like in most cases, what we say is a good, healthy, balanced diet. And so get all of your vitamin and minerals from your foods that you eat. If you feel absolutely compelled, you can take a daily multivitamin to replace some of those. But there hasn't been any data to show that vitamin D, zinc, or anything, these other things prevents infection or decreases the severity of infection.
I want to switch gears a little bit to schools. School started in some places in Utah last week. Some start on Monday, and Salt Lake County, I think, is in a couple of weeks. And the first thing I want to talk about is how parents can kind of help protect their families after the children starts going back to school. So is there anything that a parent should be doing to keep themselves a little bit more clean or help potentially prevent infection when the child goes to the classroom and then comes home for the day?
Yeah, this is a huge change for our communities, right? We've been keeping our kids home, decreasing their social contacts, and now we're in some areas sending them to school, and schools are doing a variety of things to keep them safe within the school, and some are doing remote learning. Salt Lake City is doing remote learning for the first quarter. If you're sending your child to school, things I'd be thinking about when they're coming back home from a day at school. One, making sure that they wash their hands. And so maybe set a routine. When they come in the house, the first thing you do is do hand sanitation and you wash their hands. Second, if they have items that are kind of high touch items, especially things like potentially lunch boxes, things that are made of whatever, stainless steel or whatever it might be that are high contact surfaces, maybe take, Clorox wipe or some kind of cleaning wipe and just wipe those off. And then the third thing is, if they're wearing cloth masks, which most kids are going to be doing, if you have a cloth mask, just make sure you're washing that on a routine basis. We want that. Think of that also as a fomite or something that can potentially transmit disease. And so whether you wash them every other day, every third day, just make sure you have a pattern in place that you actually wash those things. You can get really, aggressive with this. You can make them change clothes. You can make them shower and bathe, whatever it might be. We haven't seen any definitive data to show that the virus transmits that way. So I'd focus on simple things that you can do well. And that includes washing your hands, washing that face mask on a routine interval, and then just wiping down high touch items like lunch boxes, maybe, writing utensils, things that would be shared amongst the class.
Another question along that lines too is the after school aspect. Is my child, or should my child have play dates with their friends? Are they allowed to go hang out with people a little bit more freely now? What are your thoughts and advice for parents on how they handle those types of things?
Yeah, so, going back to school, you're increasing risk inherently, right? You're going back to school, you're hopefully cohorting with a group of other children. So you've already increased your risk a bit, and you're doing things to mitigate that, right? The schools are doing things, or community transmission is going down, and you're assessing your own personal risk. Once you then start doing more social activities, more after school activities, you're then increasing your risk even further. And so you really have to kind of reconsider all of those things. And maybe it's the fact that you're like, hey, I'm doing social activities after school with, members of my cohort or my classroom. And if that's the case, you've been exposed to these other kids all day long. I think that's probably safe. But if you're saying, you know what, I'm going to go after school and play with, maybe children from other classes or other schools, well, you're now increasing your risk another level because you're increasing your close contact with other people that aren't necessarily in that, close cohort that you've been socializing with or learning with. And so it definitely increases your risk. And maybe for some families, that's okay because they've assessed, they're like, listen, we're low risk. We don't live with any elderly adults. We're not immunocompromised. And that's a decision that you make personally. I would just say if you're going to do that, that continue to take those measures that decrease your risk, wearing a mask and washing your hands, and also knowing what the situation is with the children that they're going to be socializing with. Have a discussion with their parents like, hey, what are you doing to minimize your risk? What are your kind of your theories on not theories, but what is your practice on social distancing? And hey, do you have any high risk members in your community, in your household? Because if my child has, coronavirus, I don't want to give it to your child who then gives it to a sick member in your house. And so I think assessing your risk understanding where you're at on that spectrum and having good communication with the people that they're playing with is probably the best you can do.
I want to talk a little bit about college students as well. Colleges start next week for the most part in Utah, and there's going to be a lot of out of town people coming into the state. Do you feel like there is going to be potentially an uptick in cases in that age demographic of people bringing it in from other states and potentially spreading it? And is there anything we could really do to prevent that if that's the case as well?
Yeah, I mean, college is going to be really hard. Look at what happened to UNC. I mean, UNC went back to school, and within a week, they shut everything down due to increased cases. Look at Notre Dame, same kind of deal. They required testing when they came in, and they had about 0.25% that were positive. About a week into school, 12% positivity rate. Okay, so Michigan State just shut down as well. I mean, if you think about a perfect venue for transmission, right? You've got young kids living in dorms, liking to get together. I mean, this is a perfect situation for viral transmission. And not to mention that you're now having people coming in from all over. The travel bit isn't as, concerning as it used to be because coronavirus is everywhere. So we've got coronavirus in our community. California does too. So does Nevada. So does Colorado. And so, I think it's probably the bigger risk for people that live in rural communities that haven't been affected, that are then coming into a city that has significant community transmission. I worry a lot about colleges because it's the perfect population for transmission. And we already saw it at UNC, Notre Dame, and Michigan State. So it's going to have to be definitely focused. The silver lining is that those kids typically don't get severely ill. And I say typically because it's not 100%. We've had young teenagers, 18, 19, and low 20s that have been in our ICU. So they definitely can get sick. So yeah, nervous about colleges. We will likely see an uptick in transmission in that age group if college goes back and people are in dorms, even if they're spread out.
I know that some universities, especially in Utah, are doing some sort of hybrid model, but it'll be interesting to see what happens in the next couple of weeks. I start school on Monday, so I'm curious what will happen with everything. So we'll keep an eye on that. I want to talk a little bit too about the Duke study we talked about last week in reference to the buffs and gaiters being not as effective as anything else, or even less effective than not even wearing a mask. Is there any sort of update to that study at all? Have we learned anything else in the last week about those two different types of materials as far as protecting ourselves?
Yeah, well, the gator community is all up in arms, let me tell you. There's definitely been some pushback about that and the study design. And, I think the Duke people did a great job as they came up with a cheap, easy, and effective way to measure any kind of large droplet transmission. And there's been plenty of people that have come back and said, whoa, that's not definitive for these types of things. And so, there is definitely talk like, don't throw the gaiters and the bandanas under the bus, especially because people like to use them. And so I think more work's going to come out on this, just like everything else. And, in that Duke study, there was one individual saying one kind of, saying that measure this. There's going to be kind of replication of this. There's going to be other different methods to look at it. And keep in mind, there's all sorts of different buffs out on the market, right? There's like the big fleece buffs that you could wear skiing. There's the thinner variety that we see people wearing in the summer when it's 102 degrees. And so I think we're going to see more and more on this. I would say if you're wearing a buff for, an equivalent of a mask, I would say make sure you're at least doubling the layers. Okay. So instead of just wearing one, layer, those buffs are typically about 12 inches long. Double it up and wear at least a 2-layer buff. And that would be a great start in moving in the right direction as more and more data come out. And we're going to see more and more data coming out, the effectiveness of different types of masks and different types of mask materials. Masks are going to be part of our community, period, for the foreseeable future. And we're going to learn much more about the effectiveness of the different varieties. And I think that's going to advance the science. But right now, I would say if you're wearing a buff, at least double it up, give at least 2 layers to help protect our people. I think what that study does show is the really significant effectiveness of N95 masks, surgical masks, and certain cotton masks, and also shows that the vented N95s are certainly, problematic in terms of being exposed to droplets.
I think about those buffs. I'm a skier, and when I go skiing, I wear a buff, and I think about the fact that at the end of the day, they're typically wet.
Yeah.
So it does make sense that they wouldn't protect me as much, because my mouth is typically wet afterwards from some sort of condensation of the snow
Right.
or anything like that. So there is stuff getting in. And then I think another great rule of thumb with a buff too is if you can see through it, you probably are not protecting yourself or those around you. So holding it up, looking at the material, even with a cloth mask, like if you can see through something, it's probably not the most effective use of a mask.
Yeah. Great practical points. And keep in mind, there's like, I'm a skier as well. There's a merino wool buffs, there's polyester buffs, there's cotton buffs, there's all sorts of different materials. And so we just have to sort out, what's effective and what's not.
I want to talk a little bit too about the mandate for masks in Salt Lake County. Yesterday it was announced that Jenny Wilson extended it through the end of the year, which was met with some resistance. But I think it's really important to look at the fact that flu season starts soon. And maybe that decision was made because as we go into flu season, if there's an increase of that, plus an increase of COVID, our hospitals could become super overwhelmed really quickly. Why is it so important that we continue wearing masks through these winter months, even if our case counts are starting to go lower? And do you think there's a correlation between the two, wearing masks and the case count?
Yeah. You don't have to have listened to these recordings long to know that I'm a huge proponent of wearing masks. So that's, where I'm coming from. So kudos to Jenny Wilson for extending this out. The data is clear that masks work. And we saw that here locally when the mask mandate went into effect here in Salt Lake County. We saw a pretty significant decline, within 10 days of that mandate, which is what we expected. And then we saw other communities start coming down as more people masked up. Look at Colorado, for example. They had a statewide mask mandate, and they never saw a big second peak like we saw. And if you go to Colorado, I have family in Colorado, and you go there, everyone's wearing a mask. And they're in a huge, big urban environment. And so, it's a great example of one of our neighbors, having a statewide mask mandate and never seeing that big surge that we saw here in July. Okay, so I think that's a great example. So the point that you made about us going into, the fall and the winter and where masks are going to be critical, absolutely they're going to be critical. And they're going to be critical for a number of reasons. One is they're going to decrease the spread of SARS-CoV-2, the virus that causes COVID-19. That's the primary reason we're doing this. Keep in mind, though, that influenza, RSV, human metapneumovirus, paraflu, all of these other respiratory viruses are spread the same way as coronavirus is. And if anybody had young kids at home that were between 2 and 4, what you noticed in March and April of last year when you did social distancing is that nobody got sick. That was the case in my household. And that was because we were staying home. And so social distancing and masking is going to decrease the transmission of other respiratory viruses, influenza included. And what that's going to do is a number of things. One is it's going to decrease the need for testing. Okay, so keep in mind that these viruses can cause pharyngitis and can cause symptoms of coronavirus. And those people are going to need to get tested, and they're going to have to go and get tested and get that report back. And they're going to be out of school and those types of things. And so wearing a mask is going to decrease the burden of symptomatic upper respiratory infection, which is going to also minimize the amount of testing we're going to need to do for coronavirus. Okay, so that's a huge one to think about. And two is, you're absolutely right, it's going to decrease our coronavirus transmission, which is going to decrease our hospitalization and allow us to take care of patients that are sick with other illnesses in our hospitals. And so wearing a mask is going to be absolutely critical all the way through, fall, winter, and spring. And then hopefully, as we get into next summer, we'll have a vaccine, and that maybe will change the landscape of coronavirus. And, if I kind of look into the crystal ball, that's kind of the way I see us kind of moving through the winter and into the summer.
Along those same lines too, do you feel like wearing a mask when you're sick should become a part of the norm in the future? If I have a cold and I need to go to the office or something like that, I need to go to the grocery store, should I wear a mask? I know other countries have done it for a very long time. Should that become something that our culture starts to look at and understand that it's helpful?
100% agree. our culture, when it comes to being sick, was a focus on ourselves, right? So if I was sick with an upper respiratory infection, I would ask myself, like, am I going to be effective when I go to work? Like, can I go to work and actually be effective in doing my job? Same thing with school, right? The question for parents is, my child said, can they go to school and learn? Can they be effective in their role in school? That whole paradigm has to change, right? And so we no longer are going to be thinking about like, this is about me. It's more thinking about this is about public health. And am I a risk to my community, whether it be at work or at school? And so we really have to flip that on its head and think about, if I'm sick, I'm not going to work or to school until my symptoms are better. And not only does that impact me because, I can't go to work and be functional, but it's really focusing on the community. Okay. And so I think that whole kind of paradigm is going to change, and coronavirus is going to change that. But I think we also have to think about employers having to respect that. And it has to become the norm. If people come to work sick, they're going to be looked at and be like, hey, you got to go home. And, our employers have to be okay with that. And I think this idea of telecommuting and telework has really caught on. And people, if they are functional and have an upper respiratory infection, they need to stay home and work from home. And so I think there's going to be a focus on that. Now, if you have to go out and you're sick, yeah, wear a mask. That's going to decrease the transmission, regardless if you have coronavirus or influenza or RSV or human metapneumovirus. Absolutely, it's going to decrease transmission. And, mask wearing is becoming normalized. And I think that's a great thing, because what that'll do is it's going to decrease viral transmission in our community. And yeah, most of these viruses are annoying, but it decreases productivity and it kind of sucks to have. So I think the fact that masks are becoming normalized is a great thing. And absolutely, if you're sick, wear one. And I'm hoping that that continues into the future.
You brought up a really good point about this cultural shift. It's a huge thing in the United States. I have friends who live abroad, and a lot of employers here see if you're sick, you need to still come to work. So I think it'll be interesting in the next couple of months to see what happens when we go into flu season, and if that cultural shift with the workplace changes and people see that, okay, in order to keep our community safe, I need to allow my employee to work from home. That'll be really interesting to see what happens over the next couple of months with that. I have one more question about school and keeping people home. We got a recent question about, from a parent's perspective, when I should keep my child home from school during this first beginning of going back to school. Do I keep them home if they just have a sniffle, or if they have more serious symptoms? Where's the line drawn on if I need to keep my child home or if I can send them to school?
Yeah, this is $1 million question, that one that we are struggling with within Intermountain Healthcare, and people are struggling with elsewhere. Coronavirus hit right when we were seeing the tail end of respiratory season, just in general. So influenza was going away, so was RSV, so were a number of the upper respiratory viral infections. And so when we now moving into that, and can you distinguish SARS-CoV-2 or COVID-19 from any other respiratory infection, is going to be challenging. And so we are in the process of working on protocols and algorithms to really kind of suss that out. Right now, if your child has an upper respiratory infection, nothing else is going around. Okay, we're not seeing high levels of RSV. We're not seeing high levels of human metapneumovirus. We're not seeing high levels of things that cause upper respiratory infection. So right now, if you've got an upper respiratory infection, whether it's pharyngitis, severe congestion, et cetera, that is SARS-CoV or coronavirus until proven otherwise. You absolutely have to get a test. As we move into this respiratory season, it's most likely going to have to be that, yes, if you have a runny nose and those types of things, you're going to need to be either assessed for coronavirus or stay home until your symptoms are improved. I think that's going to be the key point to this. And we're working on those algorithms right now for Intermountain Healthcare. So what happens when your child is sick and you call the pediatrician? What is that pediatrician going to recommend? I think what they're likely going to recommend is either you go get tested and find out definitively, or if the patient is stable and you don't have any high risk individuals in the house, that they wait until the symptoms improve before you go back to work. that's probably where it's going to be. But I think regardless, if your child has the sniffles, that person needs to stay home and not go to school. And the question is going to be whether or not you need to go in and get tested. And most likely that's going to be a decision you make with your pediatrician or your family practice provider, whether or not you should go in and get tested. Because maybe if you yourself have chronic, medical conditions, you're worried about transmission to yourself, you're going to want to get your child testing to know what precautions you need to take in the home. And so I think that's going to be a decision you make with your clinician that you work with in your family. But I think regardless, what we say is that if they are sick with an upper respiratory infection, they need to stay home. And you should probably plan for that, to ensure that you have processes in place to allow for that. And what is your backup plan? What's going to happen? Who's going to stay home? What's that going to look like moving into the fall?
That's another question of make sure you speak with your employer too about what your options are. Last question for you for today. I want to just give a quick update about convalescent plasma and if we've learned anything about it. I know last time you mentioned that we're using that a lot in Utah as a therapeutic. Will you talk to us just a little bit about what we've learned since last week and if we've seen any progress with that?
Yeah, so in the past week, a big study has come out of the Mayo Clinic in Rochester. The Mayo Clinic is the group that has organized the use of convalescent plasma for the United States. And they looked at the use of convalescent plasma in about 35,000 individuals with coronavirus across over 2,500 hospitals. That the challenge is, and if you remember from last week, we talked about different levels of studies, medical studies to determine effectiveness. And we say that the randomized controlled trial is the top and definitely talks and definitively identifies causality. Whether or not a drug works, yes or no, as compared to a placebo. The cohort trial is much less in terms of the ability to, predict causality, but it's a heck of a lot easier to do, and it's, cheap and inexpensive. And so the Mayo Clinic study was a cohort study. It gave us some glimpses into the fact that high concentrations of antibodies likely are a benefit to mortality, and that if you give it early, it likely has a big benefit of mortality as well. It wasn't a randomized controlled trial, but it's the best that we've got right now. And so right now, Intermountain continues to use convalescent plasma. It's a safe drug. We don't see any side effects from it. And we have hints from cohort studies that it works. And so this is kind of the equivalent of where we were back in April and May with hydroxychloroquine. We just had cohort studies to, guide us, and they were mixed, but it showed a potential benefit. Then when we had randomized controlled trials showing that it didn't work, we've abandoned hydroxychloroquine. We're in the same phase of trials with convalescent plasma. We've got cohort studies that show it works. That's why we're using it. But once we get a randomized controlled trial showing its effectiveness, we'll default to that. So far, we see signals that it works. We're going to continue to use it because it's safe. But we're waiting for the randomized controlled trial to definitively say whether or not it's an effective therapy.
Eddie, is there anything else you wanted to mention today? Any last updates to the community for this week?
I think we're in a good spot right now. We're having decreased community transmission. We're seeing a lot of mask wearing in the communities. We're seeing our case counts go down. But we are really coming into a point where it's going to be, pretty remarkable to see what's going to happen as schools go back into session. So I think kind of looking forward, we're going to have a potential change in our epidemiology when schools go back. And I mean in both elementary, high school, and also colleges. That's a potential marker of where we're going to see a change in the epidemiology of this infection. And as we start getting into cough, cold, and flu season, getting in November, that's going to be another point where we're going to potentially see a change. In addition, layered onto that is it's going to get colder. People aren't going to be outside as much, and people are going to be moving inside. So I think we're in a good spot, but be vigilant, continue to decrease social contact, wear your mask, and we'll follow closely what happens with schools and then what happens closely with the fall. But those are kind of the next big inflection points, I think, coming forward.
Well, Eddie, thank you as always for joining us. We really appreciate these updates. And if you guys have any questions about COVID-19 and would like to get screened or tested, you can still call our COVID-19 hotline at 844-442-5224. We also have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks again, Eddie, and we'll speak with you next week.
Sounds good.